to our very first of 2023 Moving with MS virtual support group. Our topic for today is MS-specific physical therapy. I hope that too many of you guys haven't experienced this personally, but I have a feeling the majority of you have, where you've been to physical therapy before, or maybe it was a personal trainer or just a gym, and you either didn't notice any benefit or you felt like you were getting stronger or better balance, but your day-to-day functions weren't any easier. And a big reason for that is because what you were doing wasn't specific to MS. So I've created a few fun graphics today to explain to you how MS-specific physical therapy and exercise is different from traditional or general orthopedic. There's a whole bunch of other words we could use for anything that is not MS-specific. All right, MS-specific physical therapy. Oh, and by the way, sorry, I forgot to introduce myself. If you don't know who I am, if this is your first time here, welcome. I'm so excited to have you. My name is Gretchen Hawley. I'm a doctor of physical therapy and an MS certified specialist. And I work for my own company, The Missing Link, where I have an online platform where I deliver MS-specific exercises and content calendars so that you know exactly what to do each day to help you reach your goals. All right, so this is our outline for today. First and foremost, we're going to talk about neuroplasticity. That is something that is non-negotiable. I feel like you need to understand what neuroplasticity is in order to have the belief that you actually can work towards your goals and reach your goals when you have MS. So we'll do an overview on that, and then we'll dive into specifically how MS-specific physical therapy is different than traditional or general physical therapy. We're going to review wellness versus function, or another way I like to think of it is traditional versus MS-specific, and then newest guidelines. Okay, so this is one of my fun slides. I liked making this. So let's talk about the basics right now. So for anyone, regardless of if you have MS, for any person to flex a muscle, so to get to this point of the Hulk, maybe flexing a muscle is, I wish I had a glass here, is bending and straightening your arm to bring your phone to you or to bring a water glass. Or maybe it's squatting down to sit in a chair, or maybe it's bending your knees so that you can move forward when you're walking. Any muscle movement like that is what the Hulk represents. But in order for that to even happen, we have to start back at the brain. So in order for any muscle to work, the first thing that needs to happen is our brain needs to either have the thought of moving that muscle. For example, let's say I'm going to take a step forward. Before I even think about taking a step forward and actually moving my muscles, my brain has to say, okay, bend your knee, lift your leg, move forward. Or the only other option is that it's a reflex. So maybe I felt something sharp on the bottom of my foot, and so I automatically took a step forward. Those are the only two ways that a muscle can occur. So it's a reflex, or we have the thought to take a step or to move that muscle. Now, most times when you don't have MS, you don't even realize that you have that thought. It's automatic. When you have MS, you're probably much more aware of every single movement that you have to do. So that's the first step. And then it doesn't just go from your brain to your muscle. It has to run down the neural pathway. So your brain either has the reflex or the thought of, okay, I need to move my leg, pick my leg up, lift my ankle, bend my knee, whatever it is. And then as soon as I have that thought, there's tons of different neural pathways that light up all the way down to whichever muscle it is that I'm trying to fire. And then the Hulk comes in. Then the muscle actually works. So the reason I like this diagram so much is because it's important to visualize that there's 3 different steps. The reason it's so important is because most physical therapists who are traditional or general orthopedic physical therapists focus on strengthening just the hulk. They just focus on strengthening your muscles. And by the way, some things that I say tonight, it might sound like I'm hating on traditional or orthopedic PTs. I am absolutely not. I used to be a traditional or orthopedic physical therapist. They are amazing. I'm just going to be pointing out the differences. So there's no hate on them. But the way that they are trained is to focus on the muscles themselves. So if you were to go to an orthopedic PT, you would focus on just strengthening the muscles. However, when you have MS, as well as some other neurological conditions, the reason that you're getting weaker isn't just the muscle part, it's the nerve. So there's exercises that you can do to focus on strengthening the neural pathway. And when you do that, then your muscles will get strong. So that's why this is so important. So many people, even personal trainers, might treat you just to get stronger or just to get better balance, to get more flexibility. But in reality, it's not this part that you should be focusing on, it's this part. So move forward. So orthopedic or traditional physical therapy focuses on strengthening just the muscles right at the level of the muscle. Whereas MS-specific physical therapy focuses on strengthening your muscles through strengthening your neural pathways. So that's what we're going to be reviewing today. It's going into more specifics about that. I'm curious, I'm going to look over in the chat because I've asked this before, and I know that several of you guys are repeat attendees for our Moving with MS support group each month. So do you know what neuroplasticity is? And do you know it well enough? I'm going to leave this slide for a second. Do you know it well enough where you could explain it to someone else? So if yes, if you feel like if I was quizzing you right now in a classroom and you raised your hand and I said, Maria, what is neuroplasticity? And you could explain it to me. Or better yet, if you could explain it to someone who knows nothing about MS. So say yes if you feel like you could do that, and then no one else can see your guys' answers, by the way. It's just me, and there's no judgment. I'm just really curious on where you guys are at. So let's see, we have a yes, no, no, yes, yes. Because of you, I do. Awesome. Yes, finding undamaged pathway. A bunch of yeses, awesome. Also a bunch of no's, not well enough, awesome. Yeah, because that's true too. You can absolutely know what it is, but not well enough where you could explain it to someone else. We have some sort ofs. Repeated movement will create new pathways. Yeah, awesome. So I would say the majority of you guys are probably yeses, but no's are not too far behind. Yes, because of your instructions, not well enough. Yes to both. Yeah, okay. So we're going to review it, whether you know it or not. I personally believe that it's not possible to review it enough. It's always going to be helpful. So let's review it, especially for those of you who either have never heard of it before or you don't know what it is well enough to explain it to someone else, because that's the level I believe everyone needs to be at. So neuroplasticity has two abilities. So it is the ability of our brain to first and foremost strengthen neural pathways that we already have but have been weakened from MS, from the demyelination. It also, number two, is the ability of our brain to find new neural pathways. And this is really important because one person might need both types of neuroplasticity. Every muscle in our body has different neural pathways, meaning you might have weakened but working neural pathways for your hip flexors, but no neural pathways that are working for your knee flexors, the same person. And so how do we do this? How do we strengthen the neural pathways and find new neural pathways? Through MS-specific physical therapy. And let me just go back to here. So another way to view neuroplasticity is the ability to strengthen this so that when you have the thought of lift your leg, this neural pathway fires so much, so bright that the muscle just moves. So that would be strengthening something that's already there. However, what you don't see from this picture, and now I have the idea to add this for next time, this is just one neural pathway, theoretically. It's really a bunch of these, next to each other. But if this isn't working, so let's say you go to bend your knee and your knee does not bend at all. That doesn't mean that you will never again bend your knee. Through neuroplasticity, your body has the ability to create a new neural pathway. So if this one isn't working, with the next attempt, your brain might try to go this way. Oops. With the third attempt, it might go this way. With the fourth attempt, you might see some swirly, some zigzags. There's millions, I don't know if that's accurate, but there's tons and tons, thousands, billions, I don't know, a lot of different ways to get from point A to point B. So from your brain to your muscle. So that's what neuroplasticity is. And the reason I think it's so important to understand, to the point where you could tell someone else about it, is because it is the sole reason that people with MS actually can improve your balance, your strength, your mobility. So this is where a lot of hope can lie, especially if you're someone who finds it challenging to stay consistent with your exercises, and especially if you've tried physical therapy or exercise before, but you didn't notice much of an improvement. Excuse me. Okay. So it's been a while since we reviewed this. I wanted to put this in for the presentation today. BDNF stands for the brain-derived neurotropic factor. And this is a protein that is released in our brain, everyone's brain, not just with MS. But it's extremely important when you have MS, because when BDNF is released in the brain, it encourages growth of new neural pathways and helps sustain current neural pathways that are working. Basically meaning that when BDNF is released, it's going to support neuroplasticity. And the way that you get BDNF to release is through exercise. And certain research shows that you need to exercise for just 20 minutes in order to reduce the body's inflammatory response and get BDNF to release in your body. Additionally, the intensity can just be low to moderate, which is amazing. I don't know about you guys, but so often we feel like we need to put in all or nothing, just 100% effort in order for it to be worth it. And that's just simply not true. Low to moderate intensity level is what will release BDNF, and therefore you'll be even more likely to strengthen or find new neural pathways. Okay. Oh, also I forgot to mention, BDNF has also been shown to have cognitive improvement and alleviate depression and anxiety. So even more of a reason to exercise and get this protein. Okay, MS-specific physical therapy can improve the same things as regular or traditional orthopedic physical therapy. So of course, strength, cognition, balance, aerobic endurance, spasticity, function, depression, quality of life, walking performance. The biggest difference to me, so I've been an MS specialist we just entered 2023, so this will be my 7th year. Is that right? I think 7th year as an MS specialized physical therapist. And you can focus on the same things traditional PT does. The biggest difference is down here, your walking performance and your quality of life, your day-to-day functions. When you have MS, you can get stronger, but also not walk better. You can get stronger, but not be able to stand up out of a low surface any better. So those activities or those functions might not get any better just because your strength does. Whereas if you didn't have MS, if you gained strength, you'd probably also walk better. You would be able to get up from the floor easier. You'd not trip as often. So there seems to be this missing piece, and that's what we're going to talk about. So MS-specific physical therapy, first and foremost, focuses on functional strengthening. So yes, you do need to do strengthening exercises, but in a functional way. We're going to get into that. And some of you guys, I know this already, but I'm going to do a demonstration and I'll show you how to make exercises functional. The second thing that we focus heavily on is balance and walking, which is also the case for traditional PT, but it's slightly different. I'll show you an example of that too. And the third thing is that we have to differentiate neuro recovery versus compensation. And oftentimes we do both. So neuro recovery is essentially neuroplasticity, exercising with the goal that your neural pathways will recover and or find new neural pathways, and you will be able to use that muscle again. So there's certain exercises that you can do if that is your goal, if neuro recovery is your goal. That's what I like to focus 99% of my work on with my clients. The other side is compensation. So compensation means finding compensatory strategies so that while you're waiting for those neural pathways to build and or rewire, you have a strategy. Because let's be honest, neuroplasticity, there is no timeline. You might notice neuroplasticity improvements within a few weeks. You might notice it within a few months. You might notice it within a year and a half or 2 years. So if you're only doing neuro recovery exercises and you haven't developed that strength yet, that function, and you don't have compensation strategies, you're probably going to be tripping, and your quality is still going to be the same until you find those neural pathways, which, as I mentioned, can take a while. So I find that it's often important, and MS-specific physical therapy focuses on those neuro recovery exercises, but also compensation exercises. And sometimes that's purposely using the muscles that you have more strength in. Other times it's using tools like the leg lifter or a brace. There's so many different tools out there that can help with the day-to-day functions. So that's another way to compensate. A huge thing that is different between MS-specific physical therapy and traditional orthopedic PT is that it's not just about these things. It's not just about the strengthening, the balance, the walking, the exercise. It's about how you're feeling while you're doing those things. So an MS specialized PT should be focusing on your fatigue levels before, during, and after. So if you come to me one day and you're highly fatigued, we're not going to do the same exercise program. Or if you have more energy one day, we're going to do a different exercise program. Heat intolerance. I'll try to make this quick so I could go off on a tangent about this. Heat intolerance is when one or multiple of your symptoms worsen temporarily because of your core temperature rising by at least half of a degree. So most people think of heat intolerance from symptoms worsening due to the sun outside or hot temperatures. That absolutely occurs, but it occurs because the sun and the outdoor temperature is increasing your heart rate. Increasing your core temperature. What else increases your core temperature? Showers, especially hot showers, exercise, physical therapy. So anything that increases your core temperature can cause heat intolerance. So you might notice fatigue during your session, but it's not true fatigue. It's just because your core temperature is rising. So an MS specialized PT is going to pay attention to that. Sensation, this is a huge one. So often walking is not ideal, a little bit because of weakness, but because you can't feel your feet. If you can't feel your feet, you can't feel the ground, you're not getting that feedback to your brain from your muscles and from your sensory pathways. You're not getting that feedback of lifting your leg higher, bending your knee more, putting your leg further out so you don't almost trip yourself. So sensation is something that we focus on as well. Vision, I could go on, but there's so many factors other than your weaknesses and your balance, the exercise piece, that an MS specialized PT will focus on with you. So I wanted to do a quick example. For those that don't know me, I'm a huge visual learner, so I like to teach in the same way. So I'm going to demonstrate some orthopedic or traditional exercises, and then we're going to go into PT or MS physical therapy or functional exercise. So let me, I see Maria says, great news, only 20 minutes. Yeah, to release BDNF. Kevin's asking, if we have to work a lot on overcoming spasticity-related stretching, does that help with BDNF? So from the research that I have seen, BDNF is not necessarily released from stretching. It's more movement-based exercise. So it might be cardio or balance or strengthening, but I don't believe it's released with stretching. It's more movement-based. Great question. Okay, so I'm curious. I won't be able to see right away, but I want you guys to type in the chat if you've done any of these exercises. And I love all of these exercises I'm about to show you, but some of them are MS specific and others are not. So let me back up here. All right. Okay. So oh, and by the way, I'm going to do these on my floor because I don't have a plinth table right here, but you may have done these in the physical therapy clinic on a plinth table or at home on a bed or on a couch, not the floor necessarily. But so these are some of my favorite orthopedic traditional physical therapy exercises. So this one is called the straight leg raise. So it looks something like this, generally speaking. Have you done the straight leg raise? If so, type SLR, straight leg raise. So this is a great orthopedic exercise to strengthen your hip flexors. However, actually before I go there, I'll show you some of the other ones. So this is a straight leg raise, and of course you do it on both sides. Okay, so that's a straight leg raise. Another one is the sideline leg raise. So this one looks like this. So if you've done this one before, type side in the chat, and I'll look when I get closer to my computer. So this is a great orthopedic exercise to strengthen your glutes and the abductors, the outside of your legs. So theoretically, if this carried over to a standing position, this could help with things like knee kissing and keeping your leg out when you're walking versus a scissor gait. So that's another one of my favorites. Oh, clamshell, one of my all-time faves. So clamshell looks like this. And I don't have much hip rotation, as I'm sure you can see. If you were to do this exercise, you might be able to open up wider, but if I keep my hips where I'm supposed to, this is as far as I can reach. So this is another great exercise for the hip abductors, the glutes, the rotators. So if you've done this, type clam or clamshell. Let's see, another one is bridging. So bridging is this. Another glute one. Glutes are on my mind today, apparently. So if you've done this one, type bridging. So that's a good one as well. Sometimes you'll have a band around your knees and maybe you'll push out like this, or a ball in between your knees and you'll squeeze the ball as you lift up. Another one, the last orthopedic one I'll demonstrate, is actually a standing one. So almost every client that I have, when they've gone to traditional PT, they've done this one where they stand with their feet together or as close as they can, and then they close their eyes. And you might even have to do this. That's a specific test. Have you done that one? So if yes, type like balance with eyes closed or something, or just balance. So that's another common one. Now, before I come up and see which ones you guys have and haven't done, it's so important to understand why those ones are not MS specific ones. So the way that our brain and spinal cord work is that when you have MS, is that you don't have the same carryover as someone without MS. So what I mean by that is I do not have MS. Therefore, if I do a lot of straight leg raises, again, this exercise is to strengthen my hip flexors right here. So your hip flexors, in addition to doing this, I also use my hip flexors when I'm sitting and doing this. So theoretically, if I got really great at straight leg raise without even practicing this, I would be able to march better. Similarly, standing up, this also uses my hip flexors. So because I don't have MS, if I was able to do amazing straight leg raises without even practicing much or at all, my standing marching would also be better. Now, standing marching is also one of the movements that you need to take a step forward. So my walking would improve simply because I did straight leg raises. But when you have MS, you don't have that same carryover. So you might get full strength with your straight leg raises, but then you go to sit up or stand and use your hip flexors because you just strengthened your hip flexors a ton, but you go to use your hip flexors sitting or standing and they don't work because you don't have that carryover. So that's why MS-specific exercises are so helpful. All right, let me see what you guys have done. Bunch of people doing the straight leg raise. One person said no straight leg raise. Straight leg raise with the band, yep. Bunch of people saying side. Someone else saying no side. Side, and yes, but in yoga. Okay, a few people saying they haven't done the side one. All right, we're on the clamshell. Some people saying very few clamshells, others saying yes, yes in yoga. Clamshell, awesome. Okay, bridging. Yes, I've done bridging. I've had a lot of PT. Yep. And let me also, bridging, I think, is actually a little unique. So bridging is an MS-specific exercise, or a functional exercise, rather, if one of your goals is to improve your mobility in bed. So rolling over to one side, or if you're too close to the edge and you want to get into the middle of the bed, getting out of bed. Oftentimes we do need to do some sort of bridging in order to do those positions. So bridging isn't a functional exercise. If that's one of your goals, it definitely is a functional exercise. Lots of people do bridging. Okay, balance, yes, balance with eyes closed, balance, balance. Lots of you guys do that balance one, standing with eyes closed. MS Neuro has me do the eyes closed balance check. The eyes closed is, I recently talked about this with my missing link numbers. The eyes closed is another tricky one because generally speaking, that would be functional if you often find yourself in a position where you have to balance or walk in the complete dark. So if that is you, we all live different lives. If you live a life where that is normal for you, then it's a good thing to practice. However, most of us, the only time we're really balancing or walking in complete dark is in the middle of the night when we wake up from sleeping and we need to go to the bathroom. And even then, sometimes there is some light, whether it's night light or if you leave one of the lights on out in the hallway. So it's not complete darkness, but there's other functional exercises if your goal is to walk like from your bed to the bathroom in darkness that are way better than just standing with your eyes closed. When do we do that? Very rarely. And again, some of you guys might, but very rare. Okay. I've done all of these. Yeah, lying on the side. Yeah, okay. I feel like I'm going a little slow. I'm going to pick up my pace here, but I hope everything is making sense so far, because honestly, understanding why something is or isn't MS specific is a game changer. Because if you guys are working with physical therapists in person and they are having you do sideline, leg raise, bridging, they're not bad, but they're just not the best for you. You're not going to get the biggest bang for your buck with those ones. So traditional versus functional. So these are, I tried to think of goals that you might be creating with your physical therapist or anyone that you're working with. So if you're working with a traditional physical therapist, more likely than not, in their notes that they're writing or typing to the insurance companies, they are probably going to write notes like, let me pick someone's name, June will demonstrate 4+ out of 5 strength in her hip flexors. Lori will demonstrate balancing with her eyes closed and feet together for 30 seconds. Riva will demonstrate improved hip mobility when climbing upstairs leading with her right foot. So those are more like traditional PT. They're very focused on just strength, balance. they're not specific to your day-to-day life, whereas functional PT or functional goals would be to improve a function. So my goal might include part of that verbiage, especially if I'm working with insurance companies. I would say something like, Amy will demonstrate 5 out of 5 or 4+ out of 5 strength in her hip flexors indicated by reduced tripping when walking forward. Or let me pick someone else. Michelle will demonstrate improved balance when walking indicated by reduced foot drop or by reduced scissor gait. So it's directly associated with a function, not just strength. And if you are the type of person, in the very beginning, I mentioned if you've been to PT or you've exercised in the past and you felt stronger, but your function didn't improve, you were working on, whether you knew it or not, more traditional physical therapy or traditional exercises. And I want to point out this bullet point right here. There's a time and place for both. As you probably can tell, I focus most of my efforts and time on the functional piece because 99.9% of the clients that I work with want to get stronger so that their function is better, or get better balance so that their function is better. So I focus more on that, but there's a time and place for both. So you might have a goal of just getting stronger. Maybe your walking is actually okay right now. You just want to get stronger, whether it's related to your walking or not. Or maybe you've just always had poor balance, and generally speaking, you just want to get better balance or better flexibility. It's absolutely okay to do those more traditional based exercises, but just know that if you are looking to improve function or activities throughout the day, you have to incorporate functional based exercises. So it really depends on your goals. So I'm going to speed through this part because we've already, I demonstrated a bunch, but traditional, as we've talked about, it's just more general strength balance training. So examples would be recumbent bicycle. Let me know in the chat box if you've been to physical therapy and the recumbent bicycle was one of your main exercises. I have a love-hate relationship with the recumbent bike. I love it for cardio and for seated strength, but it is one of the least functional exercises unless you do have a goal of biking better. And I definitely have clients who do want to bike better. They have, I forgot what they're called. It's like an actual recumbent bicycle that you can use outdoors. She wanted to get better at that, so we did use the recumbent bicycle. But so many people that I work with have been to physical therapists, and they come to me for the first time and they're like, I don't know why I'm not walking better. I can now do the recumbent bicycle for 30 minutes on resistance level 6 and I still can't walk better, but I'm so much better at the bike. Biking helps with biking. Biking doesn't help with walking. It's a completely different position. Oh, I see some other comments too. So before I asked about the bike, what is the MS specific exercise? Let me know if you still need clarification, but the MS specific exercises are the functional ones, which I'm going to get to more of in a second. Yes. Scissor gait. So scissor gait is when you're walking and I'm going to demonstrate walking in a second, so I'll show you scissor gait. But it's essentially when instead of keeping your feet out like this, your feet come close to one another. You're almost tripping yourself based on how close your legs are coming. What is functional PT, or is functional PT the same as occupational therapy? No, you can do functional exercises in physical therapy and occupational therapy for sure, but the phrase functional physical therapy, it's not this, it's different from occupational therapy. Occupational therapy focuses on things like handwriting, buttoning, more like upper body and fine motor skills with your hands. Okay, so a bunch of people saying, yes, I did the recumbent bicycle, some for just a warm up, some hated it. Yes, I've used the bike, use it for stamina. I have done sidestepping. So yes, Melissa, that's functional. That could be a functional exercise. Okay, so yeah, a bunch of you guys have done the recumbent bike. So the reason, as I mentioned, the reason that the recumbent bicycle, it's a good exercise for cardio. But when you think about function, I think this is literally the next slide. So for those looking for functional exercise, hold on a sec. When you're looking for a function, you have to break down what your goal is. So the best way to think about this is if you have a goal of improving your walking, and I just keep using that as a goal because most of my clients are working towards that. So if you have a goal of improving your walking or at least maintaining your walking, what position are you in? You're in a standing position, right? When you're walking, you're standing. So theoretically, you would want most of your exercises to be done in a standing position. You'd want to be strengthening your hip flexors in a standing position. You'd want to be able to strengthen your knee flexors in a standing position, your ankle in a standing position. And the bike, you're seated. So biking won't help with the function of walking, if that makes sense. Low impact aerobics, yep. Thank you for letting me know about the bicycle. It's one of the main things that my PT provided me. Now I know that it doesn't work with walking. And again, I do like the bicycle for warming up. It's a great way to warm up your muscles. It's a great way to work on cardio for sure. And we'll talk about cardio on one of my last slides. But it's just, you shouldn't be spending most of your time on it because there's no correlation to biking better and walking better. Okay. All right, so that's the traditional. Functional, we're going to break it down. So you pick an activity. I'm just going to stick with the goal of walking better, but you pick a goal and then break that down and do as many movements as possible. And those movements are now your exercises. So I'm going to stand up right now and demonstrate this gait cycle for you. Okay. All right, I'm going to take a step forward. I want you guys watching this leg. So in order for me to take a step forward, these are the movements that need to occur. So number one, I need to be able to shift my body weight onto this front leg. Number two, I need to be able to bend my knee. Number three is swoop my toes up. Number four, bring my knee up. 5, straighten my knee. 6, heel down. And that entire time that I was moving my leg forward like this, I was standing on one leg. So single leg stance. I'll review that again. Also remember, you do get the recording to this, so you can rewatch it again. But number one, shift your weight forward. Number two, bend your knee. Swoop your toes, knee up, straighten, heel down, single leg stance. So those are the movements, and to be honest, all but one of those, or all but two, are more strengthening based. That doesn't even include the flexibility that we need to move forward. But when we're talking about functional strengthening exercises, those are 7 movements that you now can turn into an exercise. So instead of just practicing walking forward, which is also helpful, but instead of just practicing that, pick any of those 7. Let's for right now, let's go with weight shifting. The first one was weight shifting. So what I mean when I say turn that into an exercise is to literally do that movement as an exercise. So weight shifting was the first part. That was this. So one of my exercises is going to be this. I'm going to shift as much weight forward as I can and back safely. How much weight can I put on this front leg without my knee snapping back, without my knee buckling, without losing my balance? And I'm just going to go forward and back with a little bit of pauses each direction. And of course, I'll do the other side. Shift and back. So that was one of them. Another one of those 7 was marching, was bringing my knee up. So if you remember, forward, we did this, and then we did this. So that marching movement is another exercise I could do. So you can stand up, hold on to a rollator, trekking poles, whatever you got, or nothing, and march. Now, obviously, this requires balance too, which is why I like to hold on to something so you don't have to worry about the balance. If that's too challenging, Do marching in a different position. Marching, when sitting down, looks like this. You can do marching reclined. So there's lots of different positions that you can do them in. And in fact, we recently had, towards the end of 2022, we had a whole support group where we focused on the different positions of exercise. So I'll refer you to that if you have more questions about that. But that's what you do. You pick your goal, in this case, walking. You break it down into as many steps as you can think of. And if you can't think of any, talk to your physical therapist, ask them. And then all those steps are now your own exercises. So maybe it depends how long they take you. Maybe you focus on all 7. If all 7 of those things are challenging for you, in some way, shape, or form, they should be included into your home exercise program. Now, if some are really challenging, maybe you just include 3 to 4 right now. When those get stronger, then you can add some of the other ones in, so you progress to those ones. But that's what functional exercise means. That's what I call MS-specific exercise is, what is your goal? Break it down. Those are now your exercises. From there, we just find what position you can do it in successfully. Okay, how are we doing on time here? Melissa says, what if you have no movement when doing the exercise? Yeah, so if you have no movement, I'm glad you asked this because I briefly touched on it earlier, but not with this wording. If you have no movement at all, you still practice the exercise in the easiest position that's possible for you. So if marching, you can march standing, seated, lying on your side, lying on your back. Those are the most common ones. Lying on your back with your legs up. Find whichever position, even if there's no movement in all of them. Is there any one of those positions that feels like it requires slightly less effort from you? If so, pick that position and practice marching in that position as often as you can. Every repetition that you practice, if you think back to the very beginning of this presentation, every repetition that you practice, your brain is trying to find a neural pathway down to your hip flexors, if we're talking about marching. So regardless of if you have movement or not, and I know this is easier said than done, but that's truly what it takes to find a brand new neural pathway. It takes consistent effort over and over and over again, even if you see no movement. Okay, so as we were just talking about, make the exercise doable for you. If you have a goal of improving your walking, but all of those are way too challenging right now, do them sitting or seated, reclined, sideline. Find a position that does work for you. Ideally, work with a PT so they can make sure that you're doing them correctly, but it's important that you feel successful. As Melissa's question just said, what if there's no movement? You don't want to choose all these exercises where you have no movement, because that's just going to be discouraging. You're going to feel unsuccessful. And if you're feeling discouraged and unsuccessful, you are not going to stay consistent long enough to actually see results. So yes, do those ones where you have no movement, but sprinkle in some ones that are easier for you to do, even if we're focusing on legs today, but maybe it's arms. Maybe you focus on punching, maybe some bicep curls, some opening and closing of your hands. You know, there's a whole bunch of upper body stuff that you can do to feel successful if you are more successful with that. And then you're sprinkling in your leg ones too. I'm not going to click on these because we're running out of time, but I've got lots of examples on my Instagram and my YouTube page of exercising throughout the day. So if you don't have time to exercise all at once, that's okay. Research shows that exercising all at once is equivalent to exercising throughout the day. So I believe one of these, I think this one right here, is an example of me in the bathroom, and I'm sitting on the toilet and I stand up and then sit down 5 times as a demonstration of, hey, if you're going to the bathroom, once you're done doing your business, pull your pants up and stand up and sit down 5 more times. That's exercise. Commercial breaks, when you're watching TV, stand up and sit down. Unloading the dishwasher, going to get the mail, showering, putting your clothes on. Those things count as exercise too. So newest guidelines show that doing aerobic exercise first primes your brain for neuroplasticity. I remember first learning about this. So neuroplasticity is unbelievable. It is the reason that people with MS can get stronger and walk better, even though you have a demyelinating disease, a progressive demyelinating disease. It is neuroplasticity is amazing at what it's able to do for us. But not only that, aerobic exercise primes your brain for neuroplasticity. When I first learned that, I felt so giddy every time I told people this. So I was like, oh my God, not only does neuroplasticity work, but you can actually get it to work faster and better if you do aerobic exercise first. So I like to use my arms for aerobic exercise so that we don't tire our legs out, so that you can't do your leg strengthening exercises. Also, another guideline for MS specific research, as we've just reviewed, functional exercise is where you should be focusing most of your efforts. Perfect quality. Our brain remembers what we're doing more of. Oh, I forgot to demonstrate scissor walking. I'll demonstrate that in a second. If every time that you walk, you're scissor walking, meaning you're bringing your legs too far in, you are training your brain that that is how you want to be walking because you keep doing it over and over again. It's the same way that we build bad habits or good habits. Whatever we do over and over again is what our brain remembers and reinforces. So if when you're marching, your knees coming out and your foot's coming in. So you look, if when you're marching, you kind of look like this, whether you're sitting or standing, holding on to something or not. If instead of doing this, you look like this over and over and over again, you're strengthening that neural pathway so that when you actually need to march, when you're moving forward, you might trip over yourself because you're at that angle. So, and this is what scissor walking looks like. So you're just crossing in like that. So perfect quality, or as perfect as you can get it, is going to be really important. High repetitions. The only way that you strengthen those neural pathways or find new neural pathways is by repeating the desired movement over and over and over and over with perfect quality over and over and over again, which often means lots of rest breaks. When I work with my clients, one of the number one questions when we first start working together is, how many repetitions do you want me to do? How many sets do you want me to do? And my answer is usually 30 good quality repetitions. I don't care how many rest breaks you need to take. So your first set might be 10 good quality ones. Your second set might be 6 because you're a little more fatigued. Your third set might be 4. Your fourth and fifth set might be 3. So take all the rest breaks you need. Do them throughout the day. It doesn't matter. Good quality, your best quality, and as many times as you can. Also, newest guidelines show that dance has been found to be an effective form of therapy. So specifically, structured ballroom dancing, ballroom dancing and ballet dancing, seated and standing, have been found to be effective. Balance, ataxia, coordination, and isolation. So these studies that looked at dancing, ballroom dancing, and ballet, specifically for MS, found that not only did it improve balance, but it got people out of the house. It got people communicating with others. So it also improved isolation. It improved coordination in their walking. So not just strength and mobility, but these other areas. High intensity interval training is another form of exercise that has been found in MS research to be effective for MS. Keep in mind, high intensity interval training is an exercise that you feel, and all of us are different, it's an exercise that you feel is low intensity for you, and then an exercise that you feel is high intensity for you. And you just go back and forth between each of those so that you're doing something high intensity, your heart rate gets up, and then low intensity, it calms down. And you go back to the high intensity, heart rate goes up, and then low intensity. So I'm a believer that anyone can do high intensity interval training. I know it sounds scary, but it's doable for anyone. And lastly, a variable environment versus a distributed environment. So variable has been found to be effective for MS, meaning you do your exercises all over. You do them in your bedroom, you do them in your bathroom, in your living room, in your office, in your kitchen. Doing the exercises throughout your home, just different places, is effective, and throughout the day as well. So if you need more guidance from an MS specialized physical therapist, if you're looking for in-person PT, one of the first places I usually suggest going to is the National MS Society website. They have a program called Care Partner, and those are locations that you can go that have an MS specialist there that's a physical therapist. The only thing is that not all MS specialists are registered with their care program. So that's one option. Another option, the Consortium of MS Centers, which is who I am certified through, also has a resource on their website that you can use to find an MS specialized PT. And then this one can be tedious, but call your local PT clinics. I will say that MS specialized physical therapists are rare. I'm not sure what it is now, but when I was living in Boston, I was living there for 10 years, and I just moved out from there 3 years ago. When I moved, there were only 4 of us in the entire state, and myself and another was one of my colleagues, because I made her get certified too. So in the entire state. So we are rare. There's not a ton of us, but it is worth calling your local clinics. There might be an MS specialist there that is not associated with either one of these locations. One thing I forgot to write too, if you don't have an MS specialist near you, see if you can find one that you can work with in your state via telehealth. But the next best option would be a neuro certified specialist, or an NCS. And then if you wanted to work with me, I work virtually with clients through my online program, The Missing Link. These are all of the ways that you can reach me. As always, if you have any questions, my email is open. This is my website, missinglink.com. If you are looking for more demonstration-based things, I have my Instagram page, my Facebook and YouTube page. I post a bunch of videos on those. And we do have the Missing Link podcast if you not only want to learn about this in bite-sized information, but also hear from other MS experts. Oh, good question. How much aerobic exercise is needed? To my knowledge, we don't know yet. I'm going to do an annual MS conference this May. I am so excited. It's at the end of May. It's May 31st. I'm really hoping to find some new research on aerobic exercise at that conference. As of right now, we don't know. There's no research, to my knowledge, saying how long it should be or what intensity it should be. We just know that if you do it first, before your functional exercise, it's helpful. So do what you can. I usually tell my clients to do between like 3 and 5 minutes of aerobic work. Oh, good. Another good question. How soon after aerobic exercise should you do functional exercise? Again, there's no guidelines for this, so I'm just stating what my opinion is. I would say for sure within 20 minutes. And keep in mind too, we don't know how intense cardio needs to be. If you are pushing yourself so hard during your cardio or your aerobic exercise that you can't exercise for 2 hours, you're pushing too hard. Or if you don't have enough time, just do something quick to increase your heart rate. Maybe it's just punching like this as fast as you can with as much effort, and you're talking out loud at the same time. My heart's literally already racing right now. So just find something that you can get your heart rate going quick, do that for a minute, and then do your exercise. But if you're doing a full set of cardio-based movements and then you're functional, I would say try to shoot for 20 minutes or sooner. Ooh, lots of questions coming in. What duration of aerobics? Yeah, so we don't know yet. Dancing is good, I always thought so. Does any and all dance effective? So the research specifically looked at ballroom dancing and ballet. So those are the ones found to be effective. With that said, there might be other forms of dance that are equally as helpful. They just weren't researched, which is my guess. Oh, yeah, the National MS Society Navigators might be able to help too. Yeah, if you guys haven't been to the National MS Society website in a while, they started a few years ago. I feel like it was a few years, it may have been like 5 years ago, something called the MS Navigator, and right on their website at the very bottom you can chat with someone, and they are so helpful. So if you are looking for a PT, they might be able to help you. Amy says, yay for the missing link. If you work with patients online, do you take insurance? I do not take insurance. Would this be the same for stroke? I have MS and a stroke in 2018. Stroke therapy is a little bit different. However, it's my opinion that MS-specific exercises can be great also for stroke, for Parkinson's. Again, Parkinson's is a little bit different too. Fibromyalgia. I have a few clients with hemispastic paraplegia, and they found great benefit from the missing link or MS-specific exercises. What's another one? It's right on the tip of my tongue. Oh my gosh, I can't think of it, but there's other diagnoses that functional exercise can still help with, and I think stroke would be in that group. Example of aerobics. So Linda, so I know you're in the missing link. We actually have several videos in there for you on aerobic. Just a quick review. Again, I like using my upper body. So it's things like punching forward for maybe a minute or so, and then maybe it's arm swings for another minute. Maybe it's upper body jumping jacks for a minute. Maybe do some torso turns while you're punching. So you just keep moving. So that would have been 4 minutes of moving with your arms. That's going to increase your heart rate. What is your Facebook link? So my Facebook group is Multiple Sclerosis Wellness and Support. I can get the link for you guys. It's 8:01. All right, wow, I made it through all the questions. I didn't think I would. We got here. Thanks for staying tuned. So this is a group where every now and then, I haven't done it in a while, but every now and then I'll go live in there to answer some questions. It's been several months. But I'll also post videos. I will share different tips and tricks of all MS-specific exercise-related things. So just put that link in there for you guys. Had an awesome aqua session. Awesome. Is an elliptical good for cardio to start? Yeah, elliptical can be good for cardio, and elliptical is good for walking as well. Thank you. Thank you. I'll change my exercise format to include more functional exercise. Yeah, I just feel like when you have MS, you either should be doing a mix of functional exercise and then traditional exercise, or if you had to pick, just functional. If you have goals of improving your function, most, if not all, I'm going to say all people who work with physical therapists usually, and all of my clients, I can say for sure, have a function that they're trying to improve, which is why I focus mostly on that. But that's my belief. Either do a mix of both, or if you're short on time or you just want to focus on one, I personally would just focus on the function if you have goals of improving your function. When I post in the chat, it's not visible on the replay. Yeah, the chat isn't shown. So if you just go to Facebook, if the link's not working for you, I'll send it again. But if the link is facebook.com/groups/MS Wellness, or you can just search for it. It's called Multiple Sclerosis Wellness and Support with Dr. Gretchen, PT. It's a nice long name. Multiple Sclerosis Wellness and Support with Dr. Gretchen, PT. There you go. Thank you for another great webinar. You're welcome. All right, everyone, just a few minutes over. Thank you so much for tuning in. I know I say this every time, but you guys, I love the participation. It helps me feel like you guys are actually there and listening and communicating with me, which is really fun. So I will see you guys on February 13th for posture and core, which also play a huge role in function. So we'll be continuing on with our function-based exercises to strengthen your posture and core so that you can walk better, reduce low back pain, and of course, improve your posture, improve your mobility. So it'll be a great time. Always great. Awesome. All right. Thank you so much. I will see you then. Have a great rest of your month. Bye, everyone.